We'll just give everyone a minute to get in. You can go ahead and share your screen. Happy New Year, everyone. I'm Kyra Mann, CEO of Mito Action, and I'm delighted to be your host for this year's annual town meeting. As we eagerly step into a new year, we're thrilled at the prospect of what is ahead for our community, the progress that we've all worked so hard to make, although at times it feels as though we're moving at a snail's pace. But what we know with 100% certainty is that every member of this community is committed to progress, collaboration, and supporting our families to the best of our abilities, and one day soon, approved therapies to improve the lives of those living with mitochondrial disease. In the face of uncertainties of the past few years, our community has steadfastly moved forward, supporting one another and working collaboratively towards our shared goal, advancing approved therapies, and ultimately finding a cure for mitochondrial disease. It's a pleasure to have each of you here today to celebrate the accomplishments of 2023 and the hope and excitement of what 2024 will bring. Before we get started, just a few housekeeping items. To all of our presenters, kindly ensure your videos are off and muted until it's your turn to share. Attendees, if you have questions, use the Zoom chat feature or the Q&A to ask questions throughout the presentation, and we'll do our best to respond to those. For those joining by phone, you can email any questions you might have to info@mitoaction.org. Today's call will be recorded and available later at www.mitoaction.org, as well as on our podcast platforms, including iTunes, Google Play, and Spotify. We have an exciting agenda ahead featuring insights from various organizations within our community about their plans for the year and their accomplishments in 2023. To kick us off, let me first update you on the accomplishments of Mito Action in 2023. Our dedicated team has been working hard, inspired by our resilient community, always prioritizing your needs in every decision we make. In 2023, we continue to expand our support programs to ensure our families feel supported, connected, and know they are never alone. Stephanie and Susie will provide more specific details in just a few moments. We are honored to support constituents across the globe and continue to expand our reach to even remote areas where patients desperately need support and access to quality care. During the holiday season, over 100 children and their siblings received Mito Santa's holiday gifts, ensuring our Mito kids didn't go without during the holidays. Our fourth annual International Metabolic Conference for families affected by fatty acid oxidation disorders was a tremendous success, bringing together attendees from across the globe in Denver, Colorado. This event allowed families to connect, learn from leading experts in FAOD, and provided interactive sessions for the kids, who, for many, this was the first time they have ever met another child with an FAOD. Plans are already underway for the 2024 conference, which will take place in Detroit, July 21st through the 23rd. Registration will open later this month. In addition to the conference, Mito Action is committed to further supporting the FAOD community through new educational content and support opportunities, which will be available now in multiple languages, and we will also launch a community-wide FAOD survey in February. In 2023, our Dahlia's Wish program provided 6 life-changing wish trips to families through our partnership with Give Kids the World Village in Orlando, Florida. Our next round of recipients will be announced in February. So if you're interested in nominating a family, please visit the Mito Action website and complete the online form. The Matthew Hardy Camper Fund has now awarded over 100 scholarships to students with Mito pursuing a college degree, totaling more than $190,000. Our Mito students have attended prestigious universities such as Boston University, the University of Michigan, and the University of Florida, and we are honored to witness the growth and success of each of our scholarship recipients. Applications for 2024 will open on February 1st. Mito Action has taken a more active role in legislative advocacy, signing on to dozens of bills supporting the rare disease community, participating in legislative committees, and meeting face-to-face with key legislators, as well as co-hosting an FDA listening session with UMDF. We're working towards establishing a rare disease advisory council in the state of Michigan and supporting families engaged in rare disease advisory councils in their local communities. We continue to engage with the FDA to help them better understand the challenges faced by our community to help more clinical trials and therapy development move forward. And we will be sharing more in the coming weeks on how you can raise your voice in these efforts. Our MyMito platform has made a significant impact over the past year, with over 900 individuals enrolled, providing valuable data for researchers and scientists. New features will enhance users' experience, access to de-identified data, and interactive ways for users to connect. Mito Action will continue to advance this platform as a means of not only supporting families on their day-to-day journey with Mito, but also collecting valuable de-identified data that is being shared with clinicians and researchers through our partnership with the CPATH Institute. Next week, we are excited to share that we will launch a MyMito community specifically for the TK2D families. If you're interested in joining, please reach out to our team and we will get you set up. One of our newest initiatives that we are most excited to share is a new partnership with the Chan Zuckerberg Foundation, in which we will conduct a 2-year study to better understand the mitochondrial disease experience for patients and families of color. Our goal is, through this understanding, to provide vital resources and tools to help patients of color navigate their rare disease journey. We will look to understand better diagnosis, access to care, engagement with clinicians, and more. These outcomes and resources will not only be available for the mitochondrial disease community, but will also be a valuable resource for the entire rare disease community. And if you're interested in being involved in this program, please email me at Kyra, K-I-R-A, at mitoaction.org. These are just some of the highlights of 2023 and the exciting opportunities we're working on at Mito Action in 2024. We invite you to reach out to us to learn more and find ways to become involved that are most meaningful for you. So next up to share more about our support initiatives is Stephanie Harry.
Hi, my name is Stephanie Harry, and I'm one of the patient support coordinators at Mito Action and a parent of a child with an FAOD. There are many different ways that we seek to engage and collaborate with our patient community at Mito Action as we support each other in the world of mitochondrial disease, and I'll briefly speak about a couple. First, there are several different support groups that we host alongside our Mito families. We have our main support calls every Friday at noon Eastern Standard Time, our FAOD specific calls twice a month, young adult calls once a month, and our CPEO and MEET calls once a month. We also seek to support our patient community through our Mito 411 support line and email. Connecting with our patient community, creating safe spaces for us to share stories of beauty and hardship are the heart and soul of Mito Action. Living with mitochondrial disease and FAODs is a daily experience, and it challenges the way that we see and live this life. So we really value taking the time to listen and seek to better understand our community's individual and collective journey, so we can better advocate and empower the patient community. If you've not reached out or attended our support calls yet, I encourage you to do so this year. There's power when we have moments to share our stories and walk alongside each other. Our Mito Champion group is a volunteer group. This is a collective space that brings volunteers together virtually to work on various projects related to advocacy, education, peer-to-peer support, fundraising, and much more. If you're looking for a space to plug in, hone your advocacy skills, I encourage you to reach out to info@mitoaction.org, and I can share more details with you about this program. I hope that most of you listening have attended one of our expert series calls over the last several years. Zoom has really enhanced this process and allowed us to bring information to our community with a wonderful visual platform. Our expert series occur once a month, Fridays at noon Eastern Standard Time. We host clinicians and experts from the scientific community to share about their current research and also answer questions that both families and clinicians have related to mitochondrial disease. What I love about our expert series is that we're truly creating a library of knowledge for people to access. I spend a lot of time referring patients back to these topics we cover and send links to these series over the year, because in this day and age, it's really, really important that we have good access to great information, and the expert series is able to provide that. I really encourage you that if you have an idea about a topic that you'd like for us to cover, or if you're a clinician that you'd like to speak, please, please, please contact me. We would love to hear from you. You can contact me directly at sharry, Harry, at mitoaction.org. Also note that we host topics in the evening time specifically related to our FAOD community. So whether you're working with mitochondrial disease patients or FAOD patients, contact me if you're interested in doing and leading an expert series. Last but not least, Kyra already mentioned a little bit about our International Metabolic Conference for families and individuals impacted by fatty acid oxidation disorders. We are so excited about our 5th annual conference this year and working alongside Inform to plan that. We have an amazing team, committee members who have helped us hone in on topics that are important to our community. And this is just going to be another great year. So if you have questions about that space, I encourage you to reach out and ask us. It's really hard for me to explain the value unless you've been, just being able to connect with other families who have FAODs, but also just the time to connect with clinicians one-on-one. It's a space that if you haven't participated in yet, I strongly encourage you to consider that this summer. And if you're a clinician and you see FAOD patients, I strongly encourage you to mention this event to all of your FAOD patients. Please feel free to reach out to me and we can make sure that you have all the details and a flyer to give to your patients so they have better information about this time. Thank you so much for letting me share.
Thank you so much, Stephanie. And next up from the Mito Action team will be Susie Scheller, one of our patient support coordinators.
Hi, I'm Susie Scheller, and I'm a patient support coordinator with Stephanie Harry here at Mito Action. And I'm going to introduce you to 2 more Mito Action services. One is Mito Socials, and the second is the MCA Task Force. Mito Socials are support groups tied to the geography of each state or province. Mito Action contacts patient families in each state to invite family members to the virtual or in-person meeting. A local host or hostess joins a Mito Action patient support coordinator for the meetings. Mito families may discover a nearby neighbor or work together to solve accessibility problems like finding people who can provide adequate mental health care in the context of mitochondrial disease in their state. So I wanted to say, just please visit our Mito Action website, the Mito Socials tab, to view upcoming Mito Social events. February 25th, we will have one of our first Mito Socials for Spanish speakers, para Hispanohablantes. So Mito Social for Canada and one for Alaska will be posted soon. So make sure your patients know how to find the Mito Social support on our website. The second service I'm introducing is our Mito Action MCA Task Force. The task force is currently reforming. We respond when families with a child or children with mitochondrial disease are falsely accused of child abuse. The problem, like mitochondrial disease itself, has complex multi-system involvement. The task force needs professionals from various disciplines, medical doctors, lawyers, professors, survivors, social workers, and civic leaders among them. False accusations are acutely traumatic and have severe long-term consequences for our families. We need to prevent false allegations and support those who are experiencing them. And if you have any interest, please let me know. I'm Susie at mitoaction.org. And thank you so much for the time.
Thank you so much, Susie, for that update. And the last member of the Mito Action team will be our newest member, Loveland Ivy.
Hi, Happy New Year. I am Loveland Ivy, Director of Fundraising and Events for Mito Action. My theme this year is energy. I invite you to channel your energy into our global mission by participating in our annual Sandra K. Russell Derby Day benefit for Mito on May 4th in Boston. You can participate in person if you're local, wearing your best hats and bow ties, and enjoying Kentucky-themed treats and mint juleps. Registration is live now on our website, and I'll put the URL link into the chat. And of course, a cash donation as a sponsor would put you in front of our Boston community and be greatly appreciated. I am also focusing my energy on expanding our regional events, like the Energy Walk and 5K for Mito. In Boston, after a hiatus because of COVID, we're bringing back the 5K. If you or someone you know would be interested in hosting an event in their town, please send them my way. I have a playbook put together and will assist in any way and make it easy for them. So you can reach me at Lovelyn, that's LOVELYNN, at mitoaction.com. Together, we will bring energy to our community this year. And I want to thank you all for what you are doing to expand awareness for mitochondrial disease and help make the quality of life better for those that are dealing with it. I look forward to working with you, and thank you for the opportunity to serve this community.
Thank you so much, Loveland, and the rest of the Mito Action team for your commitment to this community. We are a small but mighty team, that is for sure. Okay, we're going to kick off now with our first speaker, and I'd like to welcome Paula Casanova, who is the project manager for the POLG Foundation. Welcome, Paula.
Thank you. Good afternoon, everyone. I hope everyone can hear me well. My name is Paula Casanova. I'm head of operations at the POLG Foundation. I'm honored and grateful to Mito Action for the opportunity to participate in the Mito Town Meeting today to present the POLG Foundation and our work this year. The POLG Foundation is a research advocacy group. We are laser focused on developing research for POLG disease. Sorry. We don't offer patient support, so we're immensely appreciative to all of the patient organizations taking care and offering support to patients and families going through this devastating disease. But in a nutshell, what we aim to raise awareness and to raise funds to push research into trials and to become medicines for POLG patients. We've been running for a little over 2 years now, and we've just closed an eventful year full of firsts for our foundation. One of our activities in the last year has been to put together a POLG research toolbox to be made available to researchers and industry who are interested in doing research in POLG. At the moment, this includes 2 sets of iPS cells and 2 transgenic mouse models. Some of these models will begin to be available to the wider international community of investigators in the next coming months. We've also collaborated with UMDF and Mito organization on a remote video assessment pilot study for clinical trials with Casimir as part of our efforts for clinical trial readiness. Furthering our research efforts, last February in 2023, we announced our inaugural call for proposal for research initiative grants, and we received over 15 very impressive POLG research grant applications. Upon thorough review by our scientific advisory board and board of directors, we awarded 4 investigators funding spreading over 5 years. Our projects include basic science, translational, and clinical trial readiness and are taking place at the University of Helsinki, Newcastle University, University of Bergen, and the Broad Institute. We encourage you to look at our website to learn more about these projects. Another big part of our efforts has been towards fostering collaboration across researchers globally. In June, we hosted a POLG cohort workshop spanning 2 days prior to the Euromid in Bologna, in which we gathered together for the first time 17 POLG patient cohort leaders and investigators from Europe, the US, and Australia. They all enthusiastically participated to synergize and unify clinical trial research efforts around POLG mitochondrial disease. The total number of genetically confirmed POLG patients represented by these cohorts was close to 1,000 patients. One major aim of the workshop was to initiate the creation of a harmonized natural history study to facilitate future drug development. And this is one of the big projects that we hope to continue to pursue into 2024. Our team has been globally active in international meetings such as the Euromit in Italy, the UMDF Symposium in Charlotte, the Targeting Mitochondria meeting in Berlin, and JMIT in Japan, in an effort to spread POLG awareness and encourage research and interest among investigators. A message that we would like to convey is that we are open and want to collaborate across foundations with pharma companies and industry, and that we believe it is only through collaboration that therapies and a cure for patients will come to exist. We started this endeavor to focus our efforts where there was no research before, and we will continue to work and collaborate with partners who share in our common mission. Looking at this 2024, we're very excited to announce that we have a new CEO joining next month, and we are very much looking forward to seeing where Dr. Samuel Seward takes the foundation going forward. We look forward to working together and to continue to learn from each other going ahead. If anyone has any questions or would like to discuss any of our mentioned projects, please contact us at info@polgfoundation.org or visit our website. And just thank you for your time, and thank you, Kyra and the Mito Action team, for this opportunity to speak today.
Thank you so much, Paula. We appreciate you and all the work that you do for this community. Okay,
you.
next up we have Ashley Rowland, and she is one of the co-founders of Cure ARS. Desiree, are you on here with us too?
I am. Sorry, I'm not myself, so I can't rename my name. Sorry.
No worries. Welcome to you both.
Thank you.
Ashley, you're muted.
Whoops.
There you
Apologies.
The joys of technology.
I know. So I'll just get started. So for those of you who don't know me, my name is Ashley Rowland, and I am the co-founder of Cure ARS, as Kyra said. At Cure ARS, we are supporting patients and funding research for the mitochondrial aminoacyl tRNA synthetase genes, or ARS. These are the 20 mitochondrial genes ending in ARS, such as AARS2, DARS2, EARS2, and so on. I am also the mom of my 5-year-old daughter, Aubrey, who is affected by the gene AARS2. I have an unaffected son, and I am located in New Jersey. Desiree.
Hi everyone. I'm Desiree McGee. I'm the other co-founder of Cure ARS. I have an 8-year-old daughter, Daphne, who is affected by ears too. I have an unaffected teenage daughter, and I'm located in California. Ashley and I started Cure ARS in 2021 with the common goal of joining patients together and advancing treatments for our kids and others affected by the ARS2 genes.
So over the past year, we have had 3 ongoing research projects that we are funding. We have a drug repurposing project at Children's Hospital of Philadelphia. We have a biomarker research project using proteomics at Children's Hospital in Colorado. And we received a NORD grant for a patient registry that will be launching this year. Children's Hospital in Orange County has also provided us at no cost staff and resources to assist with analyzing our patient registry. We also have been developing resources for the patient community, connecting patients through our Facebook support group, and providing support and resources to newly diagnosed. We have a number of fundraisers, such as our yearly run and our golf tournament.
We previously held 2 scientific symposiums with the support of CHOC, connecting researchers globally studying these conditions. This event is designed to share the latest developments from both the lab and the clinic and find common ground. We have been consistently communicating with other patient groups and researchers to encourage sharing of information and minimize duplication in efforts. As of October 1st, 2023, there was a new ICD code specific to the ARS genes, that is E88.43, disorders of mitochondrial tRNA synthetases. This will allow researchers and providers to gather more information on these conditions worldwide.
We are looking forward to the road ahead. Moving forward, we are interested in developing any drugs identified from our drug repurposing project, analyzing the data from our patient registry to better understand the natural history of these conditions, and creating endpoints for future clinical trials. We're also hopefully utilizing the proteomics research project as an endpoint, and we are interested in pursuing research in gene therapy.
We are open to working together and advancing treatments for anyone affected by mitochondrial disease. If you have more questions or would like to connect with us, please visit our website at www.curears.org, and I'll be sure to put all of our contact information in the chat. Thank you all so much. Thank you, Kyra and Mito Action, for having us.
Thank you.
Thank you, ladies, and especially for your commitment to this community and all the work that you do, because you have double duty. Not only are you fierce advocates, but you also are amazing moms to two incredible kids who are affected. So thank you so much for all you do. You inspire us all. Thank you. Okay, next up, we have Dave Keene and Christine Stanley with Variantics. Dave and Christine, welcome to you both.
Thank you, Kyra. It's wonderful to see you again. And a bunch of other faces that I haven't seen in a while. Christine will not be joining us. She's
I'm here.
caught up with doing the stuff that she does. Oh,
Dave,
she's
I'm
there.
here.
yeah.
Hello.
Oh, she's there. Cool. All right. Well, Christine, why don't you go ahead and kick off the from a technical perspective, new stuff that we've got coming out for the Mito community coming up.
So Dave, I thought you were going to talk, but I mean, I can talk really briefly about what we do. We do a whole genome sequencing that includes whole genome mitochondrial sequencing. We sequence the mitochondria very deeply so that we can identify mitochondrial causes of disease that are due to the mitochondrial genome. We also do whole genome sequencing, so we include all genes on the entire genome. So if there's a cause from mitochondrial disease that's in the nuclear genome, that we identify those as well. We have a process where we are looking to do two types of whole genome sequencing, both long read and short read. That's on the roadmap in 2024. And Dave, is there anything that you have in your head that I haven't said that you are planning to talk about?
Just briefly that the technology of long reads is going to solve a number of issues with current next generation sequencing issues that crop up in the nuclear genome specific to mitochondrial disease. So that's gonna, I believe, help advance the diagnosis rate for mitochondrial disease a great deal. Secondly, the mito depletion testing.
Yeah, so that's on the roadmap also. So we're looking into being able to also indicate whether there appears to be a mitochondrial depletion. So if we see that the coverage of the mitochondrial genome has dropped significantly, we are in the concept phase, and we will need to design a validation. But the plan is to include information on depletion with it. It's not a necessarily a diagnosis in and of itself, but it indicates that there may be something going on potentially in the nuclear genome that is contributing to the depletion of the mitochondria. So that is on the roadmap as well. And as Dave said, the inclusion of long read sequencing is kind of where technology in the industry is going, because it allows you to identify more variants that are missed through short read sequencing. So for those of you who aren't aware, next generation sequencing has been for the last 10 years or more surrounding short read sequencing, which is short pieces of the genome that's sequenced and then mapped back to a reference of the genome. When it's short, you can miss some things. Long read sequencing is like it sounds, it's big pieces. And so when you're putting together a puzzle of little pieces versus a puzzle of big pieces, it's a lot easier to see stuff with the bigger pieces. And that allows us to close this kind of a sensitivity gap where we're across the industry are missing variants or changes in the genome that are causing disease that are in the size range of about 200 base pairs. So we're really excited about being able to include that long read sequencing. Right now, we use it to confirm variants, but soon we'll be using it to identify variants. And then when we switch to that, we know that our sensitivity for detection will go up. So we're always aiming to really improve technical sensitivity and then improve the reports that the clinicians get and increase the diagnostic rate for patients.
Cool. All right. The other thing that I just want to mention, obviously there's a lot of um, drug development pharma companies on here. We are starting to get more interest in using our whole genome backbone as a research tool for identifying specific patients to enroll in therapy trials, things like that, because obviously you detect more variants in a genome-based test than you do in an exome-based test. So with costs coming down, it's become much more competitive price-wise. So if anybody is interested, please reach out directly to me. A lot of you know me. And if you don't, just go ahead and reach out to me through Kyra.
Thank you both so much. And to Dave and Christine, I hope everyone recognizes the amount of time that you both give to our patient community and helping them navigate the diagnostic journey, which for many of our patients, as we all know, is one of the most difficult parts. And we want to thank you both for all of the time that you give to get on the phone, walk our patients through this process, helping them get coverage, helping the docs know what to order when we have a doc who is not a mito specialist. And you guys, you truly make a huge difference to this community. And we couldn't do the work that we do without your support. So thank you both so much. We appreciate you.
That means a lot, Kyra. Thank you.
Thank you. Yes.
Thank you both. Okay, up next, we have Rini McCarthy, CEO of Stealth Biotherapeutics. Welcome, Rini.
Thanks, Kyra. Happy New Year to everyone. It's great to be here and talk to the community. You can forward along the slides. So at Stealth, we've actually been at this quite a while, focusing on developing mitochondrial targeted therapeutics. We've been working closely with mitochondrial disease patient communities like Mito Action for more than 15 years. Again, we're focused on several different genetic diseases of mitochondrial dysfunction. Our lead compound, elimipritide, has been evaluated in over 1,400 subjects. So really that helps us understand the safety profile of the compound. Some patients have been on elimipritide therapy for more than 4 years. We're deeply committed to progressing treatment options for patients living with diseases of mitochondrial dysfunction. And with that, you can probably move ahead to the next slide. So when we think about our pipeline, we do have a couple of very late-stage programs with elimipritide. With Barth syndrome, we're continuing to speak to the FDA about approval pathways. Barth syndrome is an ultra-rare mitochondrial disease, X-linked, which affects less than 150 patients in the US. And our phase 3 program in primary mitochondrial myopathy is fully enrolled. And so we'll be looking to have the last visit in that trial around the end of this year. But moving down, we do have a deep pipeline of mitochondrial targeted therapeutics. SBT272, we actually developed for improved blood-brain barrier penetration. So looking at it for some neuro indications, including ALS and Parkinson's. Our SBT550 series, we're looking at in Leigh syndrome as well as Friedreich's ataxia. These are preclinical studies. And we have other compounds that we're targeting for Duchenne muscular dystrophy. You can move ahead. Oh, sorry. So milestones coming up this year will be an NDA submission for Barth syndrome, as well as the phase 3 data in mitochondrial myopathy. Really the takeaway from this slide, and you can probably do the next build on it as well, so one more click, is that it takes a lot of time, and it actually takes a lot of staying power, right, to develop first-in-class therapies. There's a lot of unknown questions that we have about diseases where there's been no clinical development before, there's been no regulatory approvals before. So there's a lot of first-time learnings as we carry through our development efforts. In Barth syndrome, we started our process in 2014. We conducted a phase 2 trial, and then we did a retrospective natural history control study. And we've actually been talking to the FDA for about 5 years about how to take this program forward. In mitochondrial myopathy, we started our clinical development efforts around the same time in 2014. But there we actually conducted 3 trials in patients with mitochondrial myopathy before understanding from our phase 3 Power trial that we needed to go back to the drawing board and focus on a smaller group of patients, which are those with nuclear mitochondrial mutations, and those are enrolled in our new power trial. Again, that's fully enrolled. You can move forward. One more slide, please. Thanks. And you can just build this out. So I think something that's really important to keep in mind, while it takes a long time to get that first product across the line, to get that first approval for primary mitochondrial disease, historically, what we've seen with other diseases is once that first card turns over, more and more development efforts are brought to bear in the space. That's because some of the questions have been answered, right? All of a sudden you have a drug approved or you have a regulatory pathway that's understood, and it tends to draw more development. So again, from the message of having fortitude, I think the great news for this community is that over the 15 years, there's never been a point in time, but previously, where there are as many therapies in development, as many companies and investigators and doctors really looking to progress therapeutic development. That first card should turn over soon, and it should bring more and more development into the space. You can move forward another slide. I think one of the big takeaways, right, with ultra rare diseases, certainly, and if you just build out, I think there's probably another click to build this slide out, is that they do bring unique challenges, right? Because there's not a lot of patients to enroll in clinical trials. And again, regulatory pathways are uncertain. FDA has come out and said that that's not a good enough answer, right? That we can't just look at patients and say, there's nothing we can do for you. And so again, I think that this perseverance as we try to refine and develop clinical programs is super important. There are many mitochondrial diseases in addition to Barth syndrome, which are ultra rare. The definition of ultra rare isn't really a thing in the United States, but in Europe, it would suggest a disease affecting less than 6,000 patients, and even more conservative definitions of less than 2,000 patients sweep up many different mitochondrial diseases, including TK2D, Sanger syndrome, Pearson syndrome, Barth syndrome, and others. Encourage you to look at nottooraretocare.org, which is a grassroots advocacy campaign that Mito Action and Barth syndrome have established to bring along efforts with Congress and the FDA. You can move forward another slide. So for what to look out for from us in 2024, and I think if you do one more click, you'll have the whole slide here. In Barth syndrome, we will be submitting a new drug application to the FDA this quarter. In 2021, FDA refused to review our submission. We will have an answer on whether they will review this time by late Q1 of this year. And then if they do review, we'll know about an approval by year end. In mitochondrial myopathy, our phase 3 clinical trial is fully enrolled with 102 patients. This is a global trial. You can see that we have many patients in the US, as well as patients in Australia, Hungary, Italy, Germany, Netherlands, Norway, New Zealand, Spain, and the UK. Patients who enrolled in this trial do have the option of continuing to receive elamipretide therapy under our expanded access program. Our last patient last visit will be in fall of 2024, and we should have trial results by the beginning of next year. We do have a strong commitment to identify and progress new treatment options for people living with diseases of mitochondrial dysfunction. We have a really deep pipeline of new compounds, and we're continuing to do work in models of mitochondrial disease as we develop those. So look for early stage data at scientific conferences. And if you forward ahead, with that, I'd like to wish everyone a happy new year. Thank this community tremendously for the deep support we've had over the past 15 years. And I look forward to working with you in the coming 10 to 15 years as well, hopefully with some therapies on board.
Thank you so much, Rini, and kudos to the team at Stealth for your unwavering commitment, because every door that closes, every obstacle, you guys continue to move forward, and we're so grateful for that. And the Mito Action team is honored to work with you in the Barth syndrome to try to continue to raise our voices and help the FDA understand why this has to happen. And we put in the chat the nottooraretocare.org, and we would encourage everyone to go to that website so you can understand exactly what's going on and how you can raise your voice and get involved. So we encourage you to do that. And if you have any questions.
Thanks so much, Kyra. We couldn't do this without you. Thank you.
Appreciate you. Take care. Okay, up next, we have Balin Gonzalez-Sudo, who is the Director of Patient Advocacy for Ultragenics. Welcome, Balin.
Thank you. Thank you for the invitation to provide the Mito Action community with updates regarding news and information for the patient and the families living with LCFAOD. As Kyra mentioned, my name is Belén González-Sutil. I'm the Director of Patient Advocacy for Ultragenics. I am really grateful for the partnership with Mito Action and really looking forward to another year of working together. Patients and families living with LCFOD have directly shaped the topics we as a company research and that we are actively studying or will study soon, as well as the educational tools and resources that we develop through feedback provided at the advisory boards and also on our LCFOD Patient Leadership Council. These learnings and insights have helped to drive the important updates that we will share today. The updates are organized in two specific areas. The first one that I have is the progress and the status of the Ultragenics LCFOD research program. We do have a disease monitoring program, or as we call it, DMP. The DMP is a long-term prospective outcome study aiming to collect information for up to 10 years from adult and pediatric patients with LCFOD. The goals are to better understand the disease and its treatment and guide ongoing research. The participants can be on any treatment and do not need to be on triheptane or Dojolvi in order to participate. As October 2023, a total of 75 people were enrolled on our DMP. There are right now nine active sites in the US and Canada, with addition to 5 that we are going to be opening really soon. You can always learn more on clinicaltrials.gov, and we also recommend you to stay in touch with your healthcare team to discuss any existing or future research opportunities that you may be interested in. The second topic is new disease education tools and programs. So recently, we met with members from the LCFOD community in Canada and in the US to understand how we can adapt and improve the materials that we currently have available for the families in the US and Canada. We are right now currently revisiting all the material that we have, all the disease educational material, and expect new versions to be available early this year. So to close out, I really want to thank you for the interest, for the attention. I really want to emphasize how much we value the open dialogue with the LCFOD patients and families. The patients and families, they can always connect with us via our website. So we have one specific website that it's www.ultrarareadvocacy.com, where you can sign up for the Ultragenics Patient Advocacy newsletter. We're always sending information there. Then we also have a Facebook, so you can always have additional information and engagement opportunities. And you can also contact me directly through patientadvocacy@ultragenics.com. Really looking forward to working with Mito Action and the LCFOD community in 2024. I really wish everyone a safe and healthy new year and really appreciate this time to connect with all of you.
Thank you so much, Balin. We appreciate you, and we look forward to working with you on the conference coming up soon.
Thank you.
Much. Okay, up next, we have Andrea Taylor, who is the Manager of National Advocacy for the Olay Foundation. Welcome, Andrea.
Thank you so much, Kyra. Hello, everyone. Kyra, thank you for inviting us to participate again this year. It's so great to hear from so many other amazing organizations. I'm Andrea Taylor, Olay Foundation's Manager of National Advocacy. For those who are not familiar with the Olay Foundation, we are a home nutrition therapy community and advocacy group with approximately 27,000 members. Our mission is to enrich the lives of those living with home IV nutrition or tube feeding through advocacy, education, community, and innovation. We advocate directly one-on-one with members and through our Olay Ambassador Program, enteral formula donation program, and information requests. While our organization is focused on home tube feeding and IV nutrition and not directly on mitochondrial disease, there is a lot of overlap between our communities. We are introducing a new monthly virtual community building event called Community Connections. So they're an opportunity to come together and dive into specific topics important to consumers and caregivers. We'll be hosting our first community connection of the year on January 26th, and the theme will be creatively coping. Participants are encouraged to join for a casual conversation about the tools and strategies we use to cope when life gets tough, and share ways that you've adapted hobbies to fit current abilities or new activities that you've discovered as a result. Looking ahead, February 4th through 10th is Feeding Tube Awareness Month, and we'll be hosting a webinar on Tuesday, February 6th, entitled Mythbusters: Real Tips for Incorporating Real Food to Your Tube Feeding, and a Community Connection virtual social hour on Friday, February 10th, to give patients and care partners a chance to share experiences, best practices, and support one another. Our biggest event of the year is our annual Consumer Education Conference. This year's theme is Connected, and it will be held June 29th through July 2nd in Tempe, Arizona. The conference will feature thought-provoking speakers, one-of-a-kind patient-focused education, and exhibitors showcasing the latest innovations in home nutrition support. Patient-centered medicine will be at the core of the curriculum, with multiple opportunities for attendees to connect with other participants, both consumer and industry. We hope to have a record number of patient and caregiver attendees, especially first-timers. Please visit our website, oley.org, oley.org, for more information on the exciting events and advocacy efforts we have planned for 2024. Thank you again, Kyra.
Thank you so much, Andrea. And if you wouldn't mind, Andrea, just dropping a link into the chat if people are interested, so they know how to find you on your website or email, whatever is best for you. Thank you so much. Okay, next up we have Alex Dornbaum, who is the Chief Medical Officer for Reneo Therapeutics. Welcome, Alex.
Thank you very much. Can you all hear me well?
We can.
Excellent. So, as many of you know, recently Reneo completed the STRIDE study. The STRIDE study was a phase 2b pivotal safety and efficacy trial to evaluate Mavodelpar, a PPAR delta agonist, in the treatment of patients with PMM. If you recall, that study was limited to patients with primary mitochondrial defects associated with mitochondrial gene defects. The study was enrolled successfully, and it was a 6-month double-blind placebo-controlled trial. And we shared recently the top-line results of the trial publicly. And if you go to the next slide, I want to share with you the results today. Unfortunately, and with heartache, I have to say that STRIDE did not meet the primary endpoint or the secondary endpoint in the trial. The primary endpoint was the 12-minute walk test. The secondary endpoint was a measurement of fatigue. We used the PROMIS fatigue scale. We established that the patients were correctly dosed in the study. We paid a lot of attention to make sure that there were no errors committed during the execution of the trial. During the study, we measured the blood levels of the medicine in the patients that participated in the study, and that way we were able to tell that the patients that were supposed to receive drug received the drugs, the ones that were supposed to receive placebo received placebo. We also saw a slightly more increase in the number of adverse events in the Mavodelpar group, with no obvious safety signal. This is important because what that is telling us is that because the patients were getting the PPAR delta, and there are some adverse events, mild adverse events that one can anticipate that may occur, we saw those happening, and that what that is telling us is that Mavodelpar has drug activity, is doing something in the body. And then we look at a comprehensive subgroup analysis where we look very carefully at genotype, at phenotype, demographic characteristics, baseline disease severity, and even geography of the patients, comparing the geography of where the patients were enrolled, and we did not see any signals of efficacy response. If we go to the next slide, let me share a little bit about the results of the trial. So you can see here that in total, we enrolled 212 patients in the study. 108 patients received Mabodelpar, and 104 patients received the placebo. The mean age of the patients that entered in the trial was about 46 years of age. And you can see that the group most represented in the trial was the older patients, 46 to 64 years of age. There were almost twice as many women enrolled in the study as men. And this actually is something that is interesting. We have seen this in other trials in PMM as well, although we expect that the prevalence of the disease is similar in men and women. For some reason, in PMM trials, we have seen that more often than not, women are more likely to enroll in studies than men. And that is similar to what we've seen in other studies. And last, we enroll more patients in Europe than anywhere else. And we initially had hoped that we would enroll almost a similar number of patients in the US as in Europe, but for some reason, after the pandemic, the COVID pandemic, the US centers have had more difficulty enrolling patients in the clinical trials. And it has been slower in the US. For some reason, I guess there are multiple reasons why that might happen. We don't know them very well, but we were not as effective at enrolling patients in the United States as we were in enrolling patients in Europe. If we go to the next slide, these are the kind of analysis that we conducted. So I want to reassure this group that we looked at the data in every possible way we could. You can see here that there were three main groups of analysis that we did for the data. We did the full analysis set, which is just looking at all the patients that entered into the study. And regardless of what happens to them, we do the analysis. And if a patient is not able to complete the study, the result that we use for that individual would be the worst possible outcome. So that means for patients who were not able to complete the study, we use what we call an imputation. And in that imputation, you usually get a bad outcome because the assumption is that if someone wasn't able to finish the study, it was because they probably did not do well on the study. Then we did a modified full analysis set where we looked at different parameters for these patients without those big imputations. And then we did a per protocol analysis, just looking at all the patients that actually completed the study perfectly well, meaning they didn't have any trouble enrolling in the study. Everything that was expected in the inclusion and exclusion criteria were as expected. They took the medicine very well and had a lot of good compliance with coming to the visits, taking the medicine every day and not missing any of the procedures of the study, and then completed the study perfectly well. So that would be the population that you would think if they did everything according to the study, they should respond better. Nevertheless, despite doing that analysis, we didn't see any changes in any of the full analysis set, the modified full analysis set, or the per protocol analysis set. And the next slide shows the subgroups that we studied, because one question that we wanted to answer is, could it be that the drug doesn't work in the overall population of PMM patients with mitochondrial gene defects, but it may work in a subset of patients? So for example, we looked at patients that were older than 65 years or younger than 65 years. We look at difference between males and females. We looked at race. Unfortunately, or fortunately, I don't know how to express it, but the great majority of the patients that participated in the study were white, and we did not have enough patients in other groups like African American or Native American patients or Asian patients to be able to do a specific analysis of those patients. But we were able to compare, for example, what happened in the US versus what happened in Europe. We also looked at the most common mutations that we had in the study. So patients who only had the 3243 mutation, or patients who had the 8344 mutation, the MERV mutation, or patients who had the large deletion or others. And still, when we look at each of those groups, we did not see a signal of response. We also separated the data based on syndromes, patients who only had CPO or who only had MELAS or MERV or other. We did that analysis, and again, we didn't see a specific signal in any specific group. A question that was asked was, could it be that patients who are more affected at baseline, who enter the study with more disease, do worse or do better than those that come with less severe disease? So we broke down the data by whether patients could walk more or less than 500 meters or more or less than 650 meters. And we use the 650 meters because 650 is the middle of the 12-minute walk test. We expect that patients should be able to walk about 1,300 meters in a 12-minute walk test. So we wanted to see, how about those who are on top of that middle? How about those that are below? We also look at patients who had more fatigue entering into the study, or those that had less fatigue entering into the study using the PROMIS fatigue score. And there was concern that vitamin D could affect the results of the study. So we look at those that had levels below the level of detection or above the level of detection of vitamin D. And with all of these analyses, and you can see here, there were more than 30 or 40 different ways to look at the data. We actually did not see any responses. So if we go to the next slide, which I believe is my last slide, we found no obvious reason to doubt the quality of the study and the execution of the STRIDE study. I think the study was executed very well. STRIDE did not meet the primary or the secondary endpoints, and a comprehensive analysis of the subgroups did not show any signal of efficacy. So given the results of the STRIDE study, we see no viable path forward for Mavodelpar in PMM, and therefore we have decided to suspend completely the PMM program. Although the results of the STRIDE study were negative, we do believe that the data that we generated are vitally important to the scientific community, and we're working with the PMM experts to share, if not all the data, parts of our data that could be used to help design new studies with other interventions in patients with PMM. We are also, I have to say, immensely thankful, and our heart aches. But we're very thankful to the patients and families and healthcare professionals who participated in the Mavodelpar PMM program and who supported us through this process. We realize it is very tough having this chronic disease that cannot be cured, and so far all the trials that we have done have not succeeded in demonstrating efficacy. But I believe that with each of these trials, we learn a little bit more, and eventually we will be able to offer a treatment that will help patients with PMM. It's just that Mavodelpar did not show any evidence of efficacy, so we had to suspend our program. I'm going to stop here, Kira, and see if there are any questions I can answer.
Thank you, Alex. Because this is such a critical issue in the community, I'll just open it up just for a few minutes. If anybody has questions, if you want to put it in the Q&A, and Alex can answer, we'll just take a few minutes to do that. Otherwise, we also have a recording of a presentation we did with Alex last week. And he gives a lot more details. We do a very detailed Q&A that you can go back and watch. It is now live on the Mito Action website. So any questions? Going once. Oh, here we go. Let's see. Okay. All right, Alex, thank you so much. I know this was not the results that this community hoped and the team at Reneo, but we want you guys to know how truly grateful we are for your dedication to this community and all of the work that you've done. And, you know, we'll use this as a learning lesson, right? And I know you've offered to, you know, share with any of the clinicians or researchers or other pharmaceutical companies the lessons that you guys learned going through this process, so that we can all benefit and we can continue this path forward. But we're incredibly grateful to you and the team at Reneo.
Thank you.
Thank
I see the questions myself, and I can very briefly answer them. So we are planning to share the data. We are working with Dr. Amel Kara, that has an initiative to look at data of clinical trials, and we're in the process of making sure that that becomes available. We can certainly consider other groups that might need to look at the data, and we should address one by one these groups. In terms of what patients can do to get involved, what I would say is the most important thing to me, what I can say is there are two important things we learned from this trial. First, that it's very important to do double-blind placebo-controlled trials, because even though we really thought that there was a rationale for this treatment to work, after comparing it with a placebo, we saw that the drug didn't work. So what I would suggest is, I know that patients do not want to participate in trials where there is a placebo, but what I would suggest is very important is that we do continue to do trials with placebo-controlled trials, so that that you participate in those studies, so that we really find the answers to treatment. I think the only way we will be able to solve this problem is if more patients participate in clinical trials, and we come with a treatment that may help patients. Thank you very much, and I wish I could give you better news today.
Thank you, Alex. We do too, but we will continue to move forward.
Thank you.
Thank you so much. Okay, up
Bye.
next, we have Jan Smiting, who is the CEO of Chondrion. Welcome, Jan.
Welcome. Happy New Year. Can you put on my presentation, please? Okay, sorry for that. Can you hear me?
We can hear you, Jan, but we see a black screen.
Oh, you see a black screen. Yeah, I forwarded the presentation to you a couple of days ago, but if it isn't there, I can briefly summarize. Well, first of all, Happy New Year to you all. It's a pleasure to update you on the programs we have recently completed and are preparing for 2004 and beyond. My name is Jan Smiting. I'm the founding CEO of Chondrion, which is a Netherlands-based pharmaceutical company focusing on primary mitochondrial disease. Our lead product is called sonnicromanol. It targets the underlying mechanisms in primary mitochondrial disease, and more particular, it is a reductive distress modulator. It helps to restore the cell's metabolism. It's also an oxidative distress modulator, and thereby it prevents a certain form of cell death, which is called ferroptotic cell death, and it has anti-inflammatory effects in that it is an inhibitor of an enzyme which is called microsomal PGES1. The focus, the initial target of all our programs is on patients with a particular mitochondrial DNA mutation, the so-called M3243A2G mutation, which is associated with classic Milos syndrome, with MIDD, so maternally inherited diabetes mellitus and deafness, with chronic progressive external ophthalmoplegia, and also includes mixed phenotypes. The estimated prevalence in both adults and children of that particular mutation is 4.4 in 100,000 subjects, and thereby it is one of the most frequently seen classic mitochondrial diseases, meaning diseases which affect the oxidative phosphorylation system. It's like many, if not all, mitochondrial diseases, a progressive disease. It results in serious multi-system symptoms. And it is maternally inherited. So with sonnecriminol in patients with the 3243 mutation, we are building an insightful clinical data package, and we have completed a classical phase 1 trial to study the pharmacokinetics and pharmacodynamics of sonnecriminol. And we have now completed one phase 2A study, which was called the Kinergy study. And we recently completed, and that was a major effort, and for which we would like to thank all participating patients and healthcare providers. We completed the so-called integrated phase 2B program, which consisted of a 3-way crossover randomized controlled study, followed by a 52-week extension study. And I'm very pleased to say that we just completed this phase 2B program, and that program showed not only good tolerability and a favorable safety profile, now already up to 78 weeks of treatment, but more importantly, it also showed statistically significant and/or clinically meaningful results in multiple relevant outcome measures, including fatigue, muscle strength, pain, and quality of life. And obviously, in line with the expectation, analysis of the data showed more pronounced effect treatments after 52 weeks and shorter treatment periods. So, supported by the study's favorable benefit-risk profile, sonnecriminol is now progressing towards a phase 3 registrational study for mitochondrial 3243 A-to-G spectrum disorders, including classic Milos, MIDD, and mixed phenotypes. A selection of the best performing outcome measures of the phase 2B program has been prioritized as primary and secondary endpoints of a global phase 3 study. And the next steps are to finalize the preparation and initiate the registrational trial, the phase 3 study, which we hope to be the first patient in by later this year. And with that, I would like to thank Kira and the Mito Action team for having me.
Thank you, Yad, so much. We'll gather your slides and we'll make sure we include those when we post this. So thank you, and I apologize for that. Thank you so much. We appreciate you.
Welcome.
Okay, next on the schedule is Mito Hope and Help, and their director, Shannon Reed Levine, is held up in an IEP meeting for her child, and so she has sent over a message for me to share with everyone. Mito Hope and Help's main focus this year has been educational advocacy work for our homebound students and lobbying for parents of medically fragile individuals birth to 21 to be paid caregivers in New York State. Our bill will help fill the gaps in care due to the nursing shortage. We now have a bill introduced in one house, and hopefully in the next week, it will also be introduced in the Senate. We are looking for parents to help write their elected officials in support of this bill. If you're interested in helping, you can email Shannon at director@mitohopeandhelp.com. And we also have a copy of the bill that we will make available if anybody is interested in learning more about those efforts. So we're sorry she couldn't join us, but we are grateful that she sent over an update to share with the community. Okay, up next, we have Dr. Lance Becker with Northwell.
Well, hello, everyone. It's such a pleasure to be here, and I just want to thank Kira and Mito Action for allowing us to just talk for a few minutes. My name is Lance Becker, and I'm the chairman of emergency medicine for the Northwell Health System, which is the largest health system really in the Northeast in the United States. And as part of my work, I have been a mitochondrial biologist and scientist for approximately 30 years. What we have been exploring recently is the concept of mitochondrial transplantation. I don't know how many of you are familiar with that idea, but just as you might get a kidney transplant, it now appears very likely that sometime in the future, our children who need mitochondria may be able to receive a mitochondrial transplant to correct some of the terrible problems that these young people have with mitochondria. And in addition, there's likely to be a role for mitochondrial transplantation in diseases that are much more common in critical care, in cancer, and other kinds of areas. So the reason that Kira asked me to present a little bit today is that our perception right now is that the community is very, very fragmented, the scientific community. And so what we are both proposing and organizing is the first international conference on mitochondrial transplantation. So to focus really on, it's such a new area. Most of us, and I've been involved in the field for 30 years, I didn't even know that mitochondrial transplantation was possible until just a few years ago. And the investigators are just at the beginning, and there are so many questions that are unresolved that those of us in the United States, and now we're being joined by investigators, Europe and Australia as well, we just feel it's vital to come together to begin to have a dialogue about how we can advance this science in the near future. And so we anticipate putting on a conference approximately a year from now. We have all of the investigators in the United States who are working with human trials. So for the people who don't know, there are at least 2 human trials going on now with mitochondrial transplantation, one in children, one in adults. And those investigators are joining this conference. And we look to you for a few things. So I have sort of 3 requests. If you are aware of people who are doing this kind of research in mitochondrial transplantation, please let Kira or I know about those people so we can include them and invite them to our conference. The second thing is, it's very important to me. I'm the chair of emergency medicine for this huge system, and I want to keep the voice of the patients as part of our conference. And so if you have ideas on how we can keep the voice of the patient present in a scientific meeting, please share your ideas with Kira and I. And third, if there are groups that can help sponsor part of this conference, a primary reason that we don't have a date yet is the NIH, to be blunt, turned down our proposal for this conference. They think maybe the science is not quite ready. We hope to dissuade them of that, but we are lacking the funding to bring young people, to bring the speakers together for this conference. So if you have any ideas on things and organizations that we might talk to get even very small sponsorship for this conference, it will allow us to pull this whole conference off. The advisory group for this conference is made up of scientists from all across the world who are both very excited by this. They think that this has great potential, and we all want to move it faster and we're all trying to be patient, but I'm getting to the point in my career, I just want to get this done and start getting treatments out to people who can benefit from it. So, Kira, I just want to thank you again for inviting me. I'll provide my direct email after I get done talking here. And I want to thank you for the opportunity to introduce this idea. Thank you very much.
Thank you so much, Lance, and we look forward to working closely with you on this conference and continuing this conversation. Thank you so much.
Thank you.
Up next, we have the CEO of Sol Therapeutics, Dave Hennick, and I hope I'm pronouncing that correctly.
Kara, you have. Thank you.
Thank you.
Well, thanks for giving us the opportunity to speak. It's been a big year at Sale Therapeutics. Our company is pronounced Sale. It means life in Gaelic. And we've been partnering with the pyruvate dehydrogenase complex deficiency, PDCD community for a number of years to bring what we hope is an approval and a new medicine to market. So if you could send to the next slide, that would be great. 2023 was a really busy year for us and the community. We completed our phase 3 clinical trials. We're really excited about the results. We're currently in the process of preparing for filing for approval with the FDA. We have a meeting with them later this quarter. It's typical that companies have what's called a pre-NDA meeting, which is essentially a meeting where you talk about what you're going to bring to your approval package and what you're going to do to file. This is the opportunity for the FDA to ask questions or potentially tell us other things that they would like to be a part of that package. We've invested in epidemiology assessments. As everyone here can understand, PDCD is a very rare disease, and the historical literature said it was about 1 in a million. Recently, Dr. Bedoyan has done some work with newborn screening in Ohio that suggests that it's quite a bit more than 300 patients, maybe double, triple, quadruple that. So we went out and did some work with a company that focuses on doing this for rare diseases. And we'll share a little bit of those results with you today. We've partnered with trying to understand the diagnostic journey with families so that we eventually, after approval, can really help accelerate diagnosis rates and make sure that people get the treatment that they need. We've supported 4 emergency IND requests. This means that outside of our study, there have been physicians that thought that a patient had an emergency and needed to have our medicine for the time being, even though it's not approved. There's a process at the FDA that allows that, and we've supported all those that have come in. And finally, we had a listening session. The community had a listening session with the FDA about PDCD. We think this is really important because it requires a lot of bravery from the families, and it gives the FDA a real opportunity to understand the disease and really get a sense of the impact on patients' lives. Next slide. Our study was a 9-month randomized crossover study. We had 34 patients. In that study, we measured functional outcome measures and biochemical outcome measures, namely lactate. Once those patients completed, and all 34 did, 32 of them chose to stay on an open label extension study. In that study, we continue to monitor for safety events. We are also measuring survival. We are in the process of working with the FDA to compare the outcomes in our study after about 65 patient years of data with those of the natural history studies. And it looks like there's a great opportunity for a survival advantage. And that's a key thing that we're asking the FDA about in our upcoming pre-NDA meeting. The longest patient in the study is approaching 1,100 days. So we look forward to having a meeting with the FDA and hopefully finding alignment on what we need to do to progress to approval. Next slide. Like we said, the initial literature estimated that there were about 300 patients in the United States, or 1 in a million, from a long time ago. Obviously, diagnostic techniques have improved, medical understanding has improved, and we now estimate that there are probably about 2,000 patients with PDCD in the United States. Around half of them are diagnosed and being managed, mostly with the ketogenic diet and monitoring. The other half are likely patients who have presented later in life, maybe after the first year of life. And those patients are likely diagnosed with cerebral palsy or some form of pediatric epilepsy. So what this really helped us do is understand what are the challenges patients face, where do these patients actually become treated, and if we do have a medicine that's approved and we're preparing for that, how do we help make sure that genetic testing, that physicians are aware of this, and we can help educate the community to properly diagnose these patients so they're on the proper treatment regimen. Next slide. Beyond the phase 3, this is definitely the most important accomplishment for the community. A number of brave families, some experts, and then the community got together and supported an FDA listening session. This is an opportunity for the patient community to share with the FDA how devastating this disease is, what it's like to try and manage it, what it's like to have a loved one who's living with this disease, what are the things that can be done, and are the treatment options that are currently available reasonable or not. Generally speaking, the team or the session highlighted that PDCD is devastating, it's progressive. Families are doing everything they can, and they do not have enough options, and they do not have enough therapies, and so they need an approved treatment, and hopefully one that will also help them manage their children better with different types of diets and more flexible regimens for that. We know that I think there were about 25 reviewers that listened in, so these are really important meetings, and it's great to see that the community was involved and help the FDA understand the real challenges that they have. Next slide. So 2024 is a critical year for us. We continue to analyze our clinical studies. Obviously, we are preparing for regulatory filings, and we're starting to create the infrastructure for an expanded access program. One of the things that we are going to discuss with the FDA at our pre-NDA meeting is how that could be done appropriately and safely. And then we want to partner to help increase the diagnosis in PDCD. Right now, we're really excited about our clinical trial results. We're thankful to the community and everyone who's participated in this journey with us. And we are preparing for an approval, and hopefully this time next year, we'll be able to announce an approval. In the meantime, if we do open an expanded access program, we will definitely let Mito Action know so that the community can be involved in highlighting patients that may benefit from the treatment for PDCD ahead of a potential approval. Thank you very much for your time. We're excited about 2024 and appreciate everyone's assistance and help here.
Thank you so much, Dave, and we look forward to hearing more about the work that you're doing and how we can all participate and follow along and stay updated. Thank you so much.
Yeah, thanks for everything you're doing.
Thank you. Okay, up next, we have Jennifer Chickering, who is the Vice President of Program Leadership at Decento Therapeutics. Welcome, Jennifer.
Thank you, Kyra. I'm excited to be here today on behalf of our team at Decento Therapeutics. We want to tell you a little bit about our company, Decento, which is a new company founded just this past summer. And we want to share some updates on our program. And our program is not new to mitochondrial disease. So first, a little bit about our company. Decento is a clinical stage biotech company, and we're on a mission to deliver medicines that address what matters most to people living with serious diseases. We're currently solely focused on developing a drug to treat MELOS. We hope to expand to other mitochondrial diseases in the future. Though we are a new company, as I said, we're working on an investigational drug that's been in development in mitochondrial disease for a number of years, and that drug is zigosiguat. It acts on the same pathway as arginine and citrulline, but zigosiguat is a once-daily oral tablet. It's called zigosiguat now, but it was previously known as CY6463 and was discovered by Cyclerion Therapeutics. It was studied in a number of clinical trials, including an open-label study in participants with MELOS. In that study, zigosiguat showed a nice safety and tolerability profile and rapid pharmacological effects. After 29 days of treatment with zigosiguat, we saw really interesting changes, including increases in cerebral blood flow, reductions in biomarkers of disease, including lactate, reductions in biomarkers of inflammation, as well as promising impacts in the brain that we saw in imaging, in MRIs. And it was on the strength of those results that Decento was founded to carry the zigosiguat program forward. Decento is headquartered in Cambridge, Massachusetts, and we are a tight-knit team of 13 people. We're small, but we're mighty, and that's because we work with a really great network of physicians, patient advocacy groups like our host, Mito Action, and other collaborators and researchers from all over the world who are working in the mitochondrial disease community. The last thing I want to mention about our company is the meaning behind our name, Tisento, because it tells you how we develop drugs. Tisento means I hear you in Italian, and I hear you reminds us that the heart of our program is the patient and the patient voice. And we're living up to our name in the way we are developing zigosiguat. Before we start our next zigosiguat study, we're making sure we hear you, that we hear the patient, so we can measure the things that matter most. We're listening to patients in an ongoing interview study where we're asking adults and adolescents with MELAS to describe their symptoms and to describe the impacts of their disease on their lives. We're using this information, this very valuable data from listening to patients, and we're turning it into the most important measurements and endpoints in our next zigosiguat study. That study will be a phase 2b study evaluating the safety and effectiveness of zigosiguat in participants with MELAS. It will be a placebo-controlled crossover design that will allow all participants to receive active drug during the trial. And participants who are interested can enroll in an open-label extension study after that. We are working very hard to get our 2B study going later this year. And we're working both to make it as easy as possible for people to participate in and to make it a true test of whether zigosiguat can improve the most burdensome and important aspects of MELAS, the things that we're learning about now in our interview study. I want to wrap up with 2 final notes. First, I want to encourage patients and their families to consider participation in clinical trials. We hear you and we need you. Clinical trials are the only way we can get to new medicines. And second, I want to thank this community. It requires close collaboration with the broad mitochondrial disease community here today to develop drugs and get effective treatments to the people who need them. In closing, I want to say thank you to Mito Action from me and from the whole team at Tisento. We appreciate this opportunity to tell you about our company and our program, and we promise to keep you updated on our progress in the months ahead.
Thank you, Jennifer. We appreciate you and the team at Tisento, and we look forward to sharing your work with the community and how, again, we can get involved and support you in the work that you're doing. Thank you so much. Okay, up next, our next speaker is Margaret Moore, who is the Director of Education and Support Services with the United Mitochondrial Disease Foundation. Welcome, Margaret.
Thank you, Kyra, and thank you, Mito Action, for the invitation to join everyone here today. Happy New Year. I'm Margaret Moore, the Associate Director of Support and Education for the UMDF, United Mitochondrial Disease Foundation. It's just easier to say UMDF. I have a lot of exciting updates that I'm going to bring. I have too much to talk about, really, so I have one slide to kind of keep me structured, and we'll get started with some of our science-related initiatives. So top of line is MitoShare. MitoShare is a worldwide patient registry initiative stewarded by the UMDF. The registry is for our patient community. We just run it. The goal of the registry is to advance scientific research using data gathered from patients and families affected by mitochondrial disease. With each new registrant, we gain a better understanding of the disease, which in turn facilitates diagnoses, treatment, and cures, and improves standards of clinical care. Currently, we have over 1,600 participants in MitoShare, which is a really exciting place to reach. Within MitoShare, there are currently 8 surveys for patients and 1 for caregivers. These surveys help us learn more about Mito patients and their journey. So please join MitoShare today and get going on those surveys. They just help us move forward. You can join MitoShare by visiting www.umdf.org. The other thing I want to draw your attention to is a new page on our website. This is the active non-drug related research study page. So these are clinical research projects that you may be able to be a part of. Very often our industry partners need help finding people to just to help them learn more about mitochondrial diseases. And a lot of times that's what these include. So please visit. It's under our research tab, and you'll see it in a big block right at the top. The next thing I wanted to talk a little bit about is our clinical trials page. please make it a habit of visiting there. We keep it updated. It has a clinical trial finder tool, the therapeutic pipeline of all of the potential treatments that are out there. And also, I just want to draw your attention to our bench to bedside from will in February will be a clinical. We just actually had a clinical trials update. It was maybe in December. I have the wrong date, wrong month written here. So for our scientific friends on the line, UMDF's grant cycle begins on January 29th. And this is the funding for our principal investigator, postdoc, and clinical readiness awards. We continue to fund the best research wherever it may be in the world. I know that Chad and some others have mentioned the not Chad, somebody, yeah, maybe it was Chad, the FDA listening session, and what an amazing experience that was. On September 8th, 2023, we helped, along with our amazing partners of Mito Action, the Elizabeth Watt PDCD Research Fund, and Hope for PDCD, we hosted a PDCD FDA listening session. Listening sessions are really neat because they provide a unique opportunity to inform the FDA about mitochondrial diseases and help them learn about the challenges of living with a mitochondrial disease. I really want to take this opportunity to do a giant thank you to the patient family panelists that were a part of this event. They did an amazing job, and I believe that the FDA now has a far greater understanding of PDCD than they had before. We are unable to record the PDCD listening sessions, so there is a comprehensive report available at umdf.org. I want to give you a little update on our genetic testing program. So we have completed our clinician-facing no-cost genetic testing program, and it was an overwhelming success. We were able to provide more than 300 people with much-needed no-cost genetic testing. Stay tuned for information on our next no-cost program in the upcoming months. We're dedicated to helping patient families receive the testing they need. Now, moving on to the support and education side, connecting with and supporting the Mito community is a top priority for the UMDF. Through our support concierge program, we were able to help nearly 1,400 patients in 2023. If you have questions or you need help, please give us a call or reach out through our Get Support form on the UMDF website. We're here to help. We now also utilize the Unitas platform to connect families to much needed community services. And in terms of support groups, because connecting is everything, we host 15 to 20 virtual and in-person support groups per month. Please check out our event calendar and our social media to find a group that works for you. We have a variety of topics. Some are location specific, some are, whether you're a patient, a parent, caregiver, or whether you're an affected adult. So please join us. We'd love to connect with you in that way. But stay tuned in 2024 for announcement about some new groups that are coming that meet some specific unmet needs in our Mito community. We continue to celebrate our 123 support ambassadors from around the globe that help affected families every day. Our peer-to-peer support program ensures that no family has to walk this journey alone, and that the patient-family voice is a part of every aspect of what we do at the UMDF. We continue to host our monthly patient education series, Ask the Mito Doc. We will be hosting a PMM-specific Ask the Mito Doc on January 24th, featuring Dr. Amel Kara from Mass General and Dr. Michelangelo Mancuso from the University of Pisa. And on February 28th, we will be talking about ICU and anesthesia management with Dr. Amy Goldstein and Dr. Todd Kilbaugh from CHOP. So please mark your calendars for these very, very important topics. In 2023, we had more than 5,000 registrants for our support and education events. So hopefully we're touching many, many of those of you that are on the line. Thanks to the hard work and effort of our UMDF support ambassadors, our Ask the Mito Doc, our specific Ask the Mito Doc team, we now have transcripts for all of the questions from our Ask the Mito Doc webcast. I wanted to make sure people knew about this. And you can find them on a dedicated page at umdf.org. You can also, check out Mito University on our website or visit our YouTube channel for recordings of the past Ask the Mito Doc webcasts and other resources. I've heard from more than one person recently that people liked the Ask the Mito Doc playlist on YouTube because they can listen to it like on long car drives or when they're going on vacation and have to sit in the car for 3 or 4 hours. They can listen to a few of the Ask the Mito Doc webcasts, and that enduring material remains there for you so that you can refer back if you remembered it, you went to one and you forgot something and you want to listen to it again. We continue to have our monthly clinician focused education series, Bench to Bedside. And, for the clinical community, please know that Mito University for Clinicians continues to be updated and is our one-stop educational portal for clinicians. Big announcement, name change, Mitochondrial Medicine Conference 2024. For those of you that have been in the Mito community for a while, it's always been known as the UMDF Symposium, but we've grown. We've outgrown being a symposium and are now a conference. So along with the new name, you'll see a new look, a new dedicated website, but the same top quality program at our UMDF conference. You can learn more about it and see the new website by visiting www.umdfconference.org. Registration's not quite ready yet, but will be ready in February. And I also encourage our patient families out there that our scholarship applications will appear there too at that time. In terms of an advocacy update, government advocacy, we've been busy working on building the House of Representatives Mitochondrial Disease Caucus, pushing for the Medical Nutrition Equity Act, and supporting Elamiprotide for PAR syndrome. To sign up to be an advocate and to receive our monthly advocacy our advocacy updates that you get every month, please visit umdf.org. You can find it there. I want to talk a little bit about our Energy for Life walks. So our Energy for Life walks happen in 20 cities across America. You can visit www.energyforlifewalk.org to learn more about our walks, where they'll be held, and the impact that we can create together. We believe in the magic of community collaboration and invite you all to join us and be an energy maker. Chicago Marathon. The UMDS also has a charity team for the Bank of America Chicago Marathon. We have there are still a few spots available for our 2024 team. If you're interested in participating in UMDS Team Activate, please contact us at events@umdf.org. In closing, thank you again, Kyra and Mito Action, for having us. And to everyone on this call, we look forward to working with you in 2024.
Thank you so much, Margaret. We appreciate you and the UMDF team, and we look forward to working closely with you guys in 2024. Thank you so much. Okay, up next, we have Joe DeBry, who is the Director of Development and Operations at the International Mito Patients, also known as IMP. Welcome, Joe.
Hi, Kyra. Hi, everyone. Thank you so much, Kyra and Mito Action, for inviting me to speak here today. As Kyra said, my name is Joe DeBry. I'm the Director of Development and Operations at International Mito Patients, or IMP for short. It's been so great to hear so many interesting presentations today. Thank you so much to all of the speakers. And it's so encouraging to hear about all the work that's been done by our colleagues in industry in terms of drug development. Thank you to all of you for everything that you're doing. We, from a patient community, it's so encouraging and wonderful to hear. So for those of you who don't know, IMP is the international umbrella organisation for patient organisations around the world. We have 18 members from 14 countries, including some of those who are here today, Mito Action, UMDF, the Mito Foundation, who I think is speaking shortly, and also the Paul G Foundation. Our mission is to increase the quality of life for people with Mito by facilitating cross-border cooperation and collaboration amongst patient organisations. So really bringing together national patient organisations from around the world and working as one voice. So what do? Well, one of the things we do is host the World Mitochondrial Disease Week, which I'm sure most of you must be familiar with. This year it falls from the 16th to the 22nd of September, so please do mark your diaries now. Last year, we raised awareness with around 500,000 people on social media and had nearly 400 monuments across 17 countries lit up in green as part of Light Up for Mito. And this year, obviously, we want to raise even more awareness. We encourage everyone affected by Mito, including our members, industry, researchers, clinicians, and anyone else to really get involved. We've started working on the campaign and we will be sharing more details of it over the coming months. As part of Awareness Week, we also support two specific disease days, the LHON Awareness Day and TK2D Awareness Day, and we've created materials to raise awareness of those particular types of Mito, which you can find on our website. We're involved in lots of other projects, and I know time is short, so I'll highlight just a few of them. Many of you will have heard about the Global Mitochondrial Disease Patient Registry, which is part of the Genomit project. It's a multi-centered dual component registry. The first component is a clinical registry, and the second component is what IMP is creating, and that's the Global Mitochondrial Disease Patient Registry. Patients and their carers complete the same set of prompts no matter where they live, and it will result in a global natural history data set. And that data will then be able to be matched with clinical data from the clinical registry when we have both registries in a country. As Renee said earlier, it can be really hard to find the numbers needed for clinical trials in just one country. So that's one of the many reasons that we are creating a global data set. We know that getting those numbers and bringing people together across the world will create this invaluable data set. And the global registry won't necessarily replace patient organisations' national registries, as often they do collect very different data. We're actually running a pilot in the UK at the moment, and we're developing the Italian and English portals, and we're hoping the German and French portals will be developed soon after. We're working very closely with our members in the consortium, which are the Lilly Foundation in the UK, Midicon in Italy, AMI in France, and DGM in Germany. Last year, we also undertook a mapping project to identify the many registries around the world, and you can see those results on our website. Another project that we are collaborating on is Sympathic. Now, the consortium comprises of 22 international partners spread across Europe and Canada, including several university medical centres and patient organisations. And Sympathic focuses on expediting and improving drug repurposing process. There are 9 diseases within the Sympathic project, and Leigh syndrome is one of them. That's the mitochondrial disease, and that's why we are part of this consortium. We're really hopeful that Sympathic will help find an existing drug that can benefit Leigh syndrome patients. Last year, we held our annual meeting in Bologna just before Euromet. I know I met quite a number of you who were on the webinar today there. It was the first face-to-face meeting we'd had since COVID, and the meeting was really an invaluable opportunity for our members to connect and share ideas and experiences, and as well as input into IMP's priorities. It was fantastic to actually have have a lot of our industry colleagues present during that meeting as well. I'm very conscious of time, so I will be speeding through some of the rest of the things we're doing. They include things like a LHON patient forum. We've just completed the second one of those, and those forums have provided invaluable insights into the priorities and challenges faced by people living with LHON. We are a stakeholder of the European Medicines Agency, and we've recently started providing patients to participate in scientific advice procedure sessions, really to ensure that the patient voice is heard. We also support people affected by Mito, mostly for people who live in countries where they don't have a national patient organisation, and we offer guidance to anyone interested in setting up a new patient organisation. We have a private Facebook where patients and their families can connect, seek support and share experiences. IMP is a really small organisation, but we're able to do so much thanks to the generosity and commitment of some of our more established members, Mito Action, UMDF and Mito Foundation, just 3 of those. I also want to take a moment just to thank our industry partners, including Reneo, UCB and Chiesi. We really couldn't do what we've managed to do last year without your support, and we're really excited about the partnerships that will continue this year. We've got the potential to support more patient organisations, raise more awareness and to facilitate more research around the world. It's a really exciting time for IMP and bringing everyone together on a global scale. If you'd like more information, please visit our website at mitopatients.org or drop me an email and I'll put my contact details in the chat. Thank you so much.
Thank you so much, Jo. For those of you who don't know, Jo is a rock star at IMP and she keeps us all in line forward. So we're very grateful to Jo. And I would encourage you, as Jo said, we have the, really the first global patient registry is piloting in the UK and we'll be launching other countries. So please make sure you check the IMP website on how you can participate. And also, if you have any ideas or thoughts about Mitochondrial Disease Awareness Week, we just pulled together a committee to start planning, and we would love to hear any ideas that the community might have on ways that we can help to continue to raise global awareness for mitochondrial disease.
Absolutely. And I know there are a few patient organisations that aren't members of IMP yet who are here on the call. So please get in touch. I'll reach out to you. We'd love to have you as part of the community as well. Thank you so much, Kyra.
Thank you so much, Jo. We appreciate you. Okay, up next, our next speaker is Christy Balcells, who is the Associate Director of Patient Advocacy and Public Policy at UCB. Love that scarf, Christy.
So hi, everybody. I'm Christy, and I know some of you already from my prior work in the mito community. My daughter, Ava, has Lee's disease, which is a mitochondrial disease. I'm a nurse, and I'm serving the TK2D community now as the Global Patient Engagement Lead at UCB. UCB is a global biopharma company whose primary headquarters are actually in Belgium, but there are additional offices in Atlanta and many sites around the US as well as around the world. And UCB's ambition is to transform the lives of people living with severe diseases, not just rare diseases, but including rare diseases, allowing them to live the best life that they can, free as possible from the challenges and uncertainty of disease. And as I mentioned, I'm focused on supporting the TK2D community. TK2D is a mitochondrial DNA deletion syndrome that is caused by an autosomal recessive mutation of the TK2D gene. And like a lot of ultra-rare mitochondrial diseases and other ultra-rare diseases, it's really challenging to accurately estimate the prevalence, the number of people with TK2D, but the few studies that are available suggest that about 10 to 18% of people with a mitochondrial DNA deletion syndrome have TK2D variants, which may cause disease. TK2D can impact people of all ages, children and adults, and is characterized by severe muscle weakness, like a lot of the primary mitochondrial myopathies, that primarily affects the core, trunk, neck, and face. In TK2D, this muscle weakness can progress until those affected lose the ability to walk, eat, and breathe on their own. TK2D in that way is debilitating and can be life-threatening and can cause progressive and severe muscle weakness and respiratory challenges. TK2D often looks like other mitochondrial myopathies, depending on the person's age. Therefore, genetic testing is the quickest and most accurate way to accurately identify TK2D. It's been really exciting to hear all of the updates today from the many therapies and the progress in genetic testing, which makes access to clinical trials and therapies more available for patients. So to that, I'd like to thank MitoAction and all of the mitochondrial disease community for all of your efforts to raise awareness about mitochondrial diseases, for the advocacy progress made every year. I thought I could recap some of the activities that we supported over the last year, as that kind of lays the foundation for what we will do in 2024. But first, UCB has been evaluating the potential for a nucleoside therapy, doxycytine and doxorubicin, to treat people with TK2D. The clinical development program some of you may have known came from Zogenix to UCB, and that clinical program to evaluate this investigational therapy has now completed enrollment, and efforts are focused on completing timely submission of our clinical data package to the regulatory agencies, the EMA and the FDA. UCB is working closely with those agencies in the US and Europe with submissions of the final data package expected this year in 2024. In addition, in 2023, we worked with the patient advocacy organizations like IMP and UMDF and Mito Action and organizations all over the world, as well as the TK2D patient and caregiver community, to form a steering committee to help shape the projects and outcomes with our company, with the objective to work together for 2 years to have some shared objectives to advance mitochondrial medicine and standards for TK2D. Some additional highlights from 2023 are mapping of the priorities of 20 mitochondrial disease patient organizations and the global mitochondrial registries, of which there's a poster you can see on the IMP website. And that poster was shared last year at UMDF as well. We also have supported the development of a research project to assess quality of life for patients impacted by TK2D, and have collaborated on a worldwide TK2D Awareness Day with no small effort of the patients and caregivers around the world to participate. In addition, clinician awareness is a high priority and education is a high priority for UCB. So we supported some CME or continuing medical education events to physicians in Europe and the US through online and a live program, including a TK2D masterclass, which is like a clinical education program for doctors in Spain last year. I'm so excited about another year of partnership and activities, and just ask you if you have TK2D or a family member with TK2D and you'd like to connect, I invite you to reach out to me. I'll drop my email in the chat. Thank you so much, Kyra, for inviting me to be able to speak today.
Thank you so much, Christy. And before you sign off, I just want to remind everybody that there is a TK2D survey that's currently open for patients, parents, and caregivers to help understand the impact of TK2D on quality of life. The survey will close at the end of the month, so please make sure you share your voice for this important research, which is intended to lead to a publication to help clinicians and regulatory stakeholders understand better the impact of TK2D. And I will drop the link to that survey in the chat, and it's also available on the Mito Action website. Thank you so much, Christy. We appreciate you and all your work for this community. Thank you so much. Okay, up next, we have Dr. Mary Kay Koenig, who is the president of the Mitochondrial Medicine Society. Welcome, Dr. Koenig.
Thank you. Thank you, Kyra. I'm so happy to be here. I love attending this webinar every year because I learned so much about what's going on in the community and kind of what's new for the year. It always kind of gets me invigorated to get started. So I'm happy to be here today, and I'm actually going to be pretty brief, try to get you back on schedule. I just wanted to say hi and remind everybody about the Mitochondrial Medicine Society. I am acting as president this year, and I'm very grateful to be doing so. This is an organization of physicians that is here to support other physicians in caring for mitochondrial patients. Our mission is to advance education, research, and global collaboration in clinical mitochondrial medicine. So we want to be there as a resource for each other to help out in supporting the clinical care of patients with mitochondrial disease. Next slide. So right now, I'm the president. Dr. Gavrilova at Mayo Clinic is the secretary treasurer. Dr. Scalia at Baylor is the program chair. He has been amazing at helping design educational programs, both with UMDF, with Mito Action, and for the upcoming conference this summer. He also helped organize the speakers for the conference last summer. With the Mitochondrial Medicine Society, always has a portion of the speakers that we have there. We also have an international counselor, Dr. Rahman in London, and we have an international liaison, Dr. Kara, who works out of Harvard, who has been helping us advance our global initiative. And then Drs. Goldstein and Parikh are very active in the board as well. And then there's lots of other members from all over the country and all over the world, and anyone can join. So if your physician is interested or needs resources, please let them know to join the MMS. Next slide. So from an educational standpoint, we develop physician guidelines to help recognize, diagnose, and test primary mitochondrial disease with peer-reviewed publications. We create handouts for patients and our caregivers who are just beginning their mitochondrial journey. And we try to link relevant, up-to-date publications to assist kind of in everyday patient care. Next slide. We also, again, work with the UMDF to create the Mito U resource, which has some teachable components about mitochondrial disease. Anyone can access these. Any of the physicians can access these, patients can access these. So just remember that resource is there. And then again, Dr. Scoglia has been working with the UMDF annual conference. We changed the platform a little bit this year, trying to integrate the clinical sessions a little bit more with the scientific sessions to pair the topics, better crossing boundaries, and trying to get the basic scientists and the clinical scientists talking a little bit more. I think it went well. We still have some kinks to work out. Next slide. We also, in the last year, have started sending out what we call a monthly update that includes a list of upcoming conferences and online talks and lectures. The one thing that COVID-19 did for us that was really great is a lot of these conferences that used to be very local, where you would go to a talk and just listen to someone talk, they've now become global because they're now online. And so instead of just being able to go to the conference that's occurring in your own city or at your own university, everybody can listen in from all over the world. And so it's been great. So we are now listing all of those in one place and sending that out to all of the physicians who are members of the MMS once a month. So if anybody knows about a talk that needs to get included in this update, please send it to me. Also, we send out updates on recent conferences. So, and we send out information about upcoming conferences. So again, any information like that, please try to send it to me. If you want to get this newsletter and you're not getting it, please let me know. You do have to be a member of the MMS in order to get it. And it is geared towards physicians. But again, we're happy to include any physician or any clinician, I shouldn't say physician, any clinician who cares for patients with mitochondrial disease. It also has links to currently enrolling clinical trials and studies. Next slide. And then we've been working on some research projects. Again, these are very clinically based. Dr. Parikh headed up a project last year looking at mitochondrial mortality. And then Dr. Kara is working on a project looking at Paul G. And then we work with the MCN, the Mitochondrial Care Network, to try and help, again, foster this kind of standardization of care for mitochondrial patients, making sure that everybody is has the resources they need to provide the latest care to patients with mitochondrial disease throughout at least North America. Thank you. Next slide. And so that's us, the Mitochondrial Medicine Society. Again, we're here as a resource to anyone's physicians, clinicians, not just your doctors, your physical therapists, your primary care physicians, anyone that is looking for advice or help in caring for their patients.
Thank you so much, Dr. Koenig. We appreciate that. And we'll drop those links in the chat so that everybody can access and visit the MMS website. Thank you so much. Have a great day.
You too.
Next up, we have Casey Wolben, who is the founder of Cure Mito. Welcome, Casey. There you are.
Hi, Kyra. Happy New Year. Thanks for having us. We really look forward to this every year, and what you do at Mito Action is amazing, and just thank you so much for the invitation. I'm Casey Wolben. I am the mom to Will Wolben, who is 12 years old, who has Lee syndrome. Cure Mito Foundation was started by a group of parents of children who are affected with Lee syndrome. So our mission is to unite the global Lee syndrome community to accelerate patient-centered research, treatments, and cures. Next slide, please. We've been busy. We've been real busy this year, or this past year. As you've heard from several other speakers, the FDA has had several listening sessions, and we had the pleasure of having an FDA listening session for the Global Lee Syndrome Registry that Cure Mito has. And we brought attention to endpoints, and that will help clinical trials better for Lee syndrome, understanding the disease, things like that. We launched a new website called aboutleesyndrome.com. This website is dedicated to Lee syndrome, and it's for families and healthcare providers to gain resources regarding Lee syndrome research, and just how to speak with a family who has Lee syndrome. When you're going through that diagnosis process, it's hard. I mean, I remember our diagnosis day. So we do have some tips for some healthcare providers on there. We've been busy collaborating with the Child Neurology Foundation on a Lee syndrome page, Mito World. We are a part of the Health Defense Research Consortium now. And we established our corporate advisory council, and we're grateful for all the participation in that. It was very successful, and we will continue again in 2024. We did have 3 published papers, 2 in the Orphanet Journal of Rare Diseases, and 1 that's coming out in the Journal of Society for Clinical Data and Management regarding our CDISC standard for registries. We are a part of the CPATH Mito Task Force. It was the press release was released yesterday, so we're super excited about that. There's, I think, 4 or 5 other organizations that are involved with that. So if you do want to know more or do want to get involved, please reach out to either CPATH or us, and we can make that connection. We did have our 2nd annual Lee Syndrome virtual symposium. We had over 250 attendees, and one of those Orphanet journal papers was based on our first symposium. Our registry numbers, a little update on that. We do have our Lee Syndrome Global Registry. So if you're not a part of that, please sign up. We've heard this many times before today. It's important. Sign up to all of them. So right now, our Lee Syndrome registry has over 300 participants in 37 countries. We are just partnered with Hope for PDCD and hope to grow and learn more from PDCD and Lee Syndrome, since there's commonalities in that. We funded research at UT Southwestern here in Dallas, Texas, and Cambridge for gene therapy for Lee syndrome, for SIRF1 and ATP6 mutations. We are super excited about the progress. We will be giving updates soon. We also have 2 drug repurposing programs for Lee syndrome that we are currently working on, and that we will have updates for those in the next quarter as well. Next slide, please. So what's our future? Well, first of all, if you want to get involved, if you're a parent or if you are an industry partner working in mitochondrial disease, we'd love to have you. We'd love to collaborate. We are a grassroots effort organization, parents who are on a mission to get Lee syndrome out there and hopefully get a treatment and a cure for our kids. We want to expand the global registry. We share consistently with the findings with our community. So whenever we see something that's interesting, we share that with the Lee syndrome community, and which is great. I always feel, even knowing how many kids have feeding tubes, to me, that's, as a parent, that's valuable. That's good knowledge. So we are constantly sharing insights with the community. We will continue to fund gene therapy and drug repurposing studies. We do have our biobank at Coriell, which is an agnostic institution run by the NIH that is any researcher can access. Of course, collaborate with CPATH and the Mito Task Force. we are excited that we did join the Health Defense Research Consortium, so we're super excited to participate in that. We'll be hosting our 3rd annual Lee Syndrome Symposium and continue our corporate council and hopefully push towards our goal for a treatment or cure for our children with Lee syndrome. We appreciate this entire community. We are so happy to be involved, and whatever we can do to make this mitochondrial disease, specifically Lee syndrome, out there, let's do it together. It takes a village. So thank you so much for having us, Kyra.
Thank you, Casey. And we continue to be impressed with the incredible work that you guys are doing at Cure Mito and the progress that you're making. So, continue to inspire the community, and we're really grateful for all that you do. Up next, we will have Jessica Lindenberger, who is from UPMC and Inform. Welcome, Dr. Lindenberger.
Hello, thank you for the invitation to present today. My name is Jessica Lindenberger. I'm a clinical research nurse practitioner at the University of Pittsburgh Medical Center Children's Hospital in Pittsburgh. Next slide, please. Today I'm going to be talking about 2 of the currently enrolling investigational treatment studies we have for our MCAD deficiency patients. We're working with 2 companies right now, Acer Therapeutics for a phase 2 open label fixed dose study for the use of sodium phenylbutyrate, also called Acer 001. For MCAD patients with at least one of the common mutations. And then Ultragenyx also doing a phase 2 trial where we are looking at the use of triheptanoin, also known as C7, or Dojolvi, again, for the treatment of our MCAD deficiency patients. Next slide, please. So a little bit of study background for these. We performed a study back in 2015 to 2016, a phase 1 trial using sodium phenylbutyrate on our MCAD patients that had at least one copy of the common 985 mutation. They came in for an inpatient fast for 12 hours, and we did some labs, and then they, for subsequent visits, they would come back for a 12-hour fast after being at home, after being on the study medication as listed below for 2 weeks. In this trial, we used the product Ravicti that's currently FDA approved for urea cycle patients. And then in this collaboration with Acer, we're using their sodium phenylbutyrate product, which I said was also called Acer 001. In that trial with Ravicti, we had 4 adult patients, and then we were able to see some changes in their metabolites that suggested we had improvement in their MCAD, which prompted us to continue on to use the phase, to go to the phase 2 trial. For the triheptanoin, Dr. Vockley and his lab performed several clinical studies using fibroblasts from SCAD and MCAD patients, and they were able to determine that C7 was able to be utilized with MCAD patients, and it was utilized via the SCAD pathway. And they did this, like I said, using fibroblasts, but also in a mice study where they were able to see a decrease in fat in the liver tissue, which showed us that the body was able to break down fat for fuel, which we know with our fatty acid oxidation patients is an issue. And also we saw an increase in glucagon in the liver. Dr. Arnold gave a presentation back in the fall that goes into more detail about the study background. So I recommend listening to that if you would like to hear more. Next slide, please. So for this study, we have two aims. We're really looking at safety and tolerability. Both of these medications, like I said, are FDA approved. The Acer product is an approved product for urea cycle disorders. And we know C7 is also Dojolvi, which is FDA approved for our long chain fatty acid patients. So we have a lot of safety data, but we're always looking at safety whenever, we're doing a clinical trial. And then our second aim is to kind of confirm that we see that decrease in hypoglycemia and those changes in the metabolites that we saw in the previous study. Next slide, please. So inclusion criteria for this, this is not all the inclusion criteria. This is just kind of the key inclusion criteria, but we are looking for the Acer study, the MCAD patients with at least one copy of that 985 mutation. And for that study, we will have two dosing cohorts. We'll have patients who are 16 and older, and then we also have the opportunity to look at our younger patients, 10 to 15 for cohort 2. Our goal, with these studies is, again, looking at that safety data and that efficacy, with eventually going down to the lower cohort, a cohort with younger patients, because we know that's where the difficulty is with prolonged fasting. And, that's where we really want to be able to utilize these treatments. And then for Ultragenyx, again, having a diagnosis of MCAD and being 16 years and above. Next slide, please. Again, this is a pretty lengthy exclusion criteria, and it's not entirely inclusive of everything, but just the gist of it, not being on another investigational product, any kind of abnormalities baseline with like liver and kidney function, because we obviously wouldn't want you to be on a medication that would cause additional issues. And then also for both of these, any underlying diabetes, either type 1 or type 2, that could cause additional hypoglycemia or contribute to that with fasting. Next slide, please. So for the study design, you would come to a children's hospital in Pittsburgh. You'd hang out with us for a couple of days. For the Acer study, you would, if you're in the younger cohort, you would fast up to 18 hours. If you were 16 and above, you would do the 24-hour inpatient fast. And then we also have an 8-hour post-dose PK sampling, so we can get a better idea of the drug utilization. And this is up to those time periods. We will continuously be monitoring patients for any signs and symptoms of hypoglycemia. And if that would occur, we would immediately stop their fasting and collect what samples we can at that point. Those cohorts also will have different dosing schemes associated with them. You would continue on that medication for 4 weeks, and then you would come back and have a second follow-up fast, an overnight stay. So for each one of those stays, it would be about 3 days total here in Pittsburgh. For the Ultragenyx study, you would come in for a 24-hour inpatient fast as well. After you completed that fast, you would start on the C7 for 8 weeks. And then 4 weeks into that 8 weeks, you would come back for an additional admission, repeating the same things we did at that first fast. And then after the second 4 weeks, again, you would return for another overnight stay to collect some more data, and then you would be completed with the study medication. You would stop taking the study medicine. Next slide, please. So some additional notes: compensation and travel expenses are provided for participants. So that helps a little bit with that burden. Participants can participate in both studies if they desire. You would just have to have a medication washout period in between both of those studies. Next slide, please. So if you're interested in participating, Elizabeth McCracken is the research coordinator for the study. And like I said, I'm the research nurse practitioner. So our contact information is there. Feel free to reach out to us with any questions. Next slide, please. And then I just briefly wanted to talk about INFORM, which is our International Network for Fatty Acid Oxidation Research and Management. It's headquartered here out of the UPMC Children's Hospital of Pittsburgh. It's led by Dr. Jerry Vockley, who's the co-chair and founder, and Keith McIntyre, who is the INFORM program manager, as well as collaboration with a group of US and international physicians. Next slide, please. This is the INFORM website. Also on there, you can locate a patient and family section where there is an Ask the Expert section where you can ask any of your questions, and 99% of those questions are answered by Dr. Vockley. The INFORM has a lecture series that's held the third Monday of each month, starting at 10 a.m. Eastern Standard Time. You can give Keith send Keith an email to get added to that invitation list. His email can also be found on the contact page, contact us link at the right upper hand corner on the website. This year, their international meeting is being held in Porto, Portugal, September 1st and 2nd. INFORM tags on to the SSIEM meeting that is September 3rd through the 6th. Next slide, please. So thanks, Mito Action, for being INFORM's connection to patients and families nationally and internationally.
Thank you so much, Jessica. We appreciate you and working with INFORM and Dr. Vockley. In the chat, Stephanie put the link to the presentation that that Jessica referenced. So feel free to check out that presentation by Dr. Arnold. Okay, up next, we have Tony Catan, who is the general manager of the Mito Foundation in Australia. Welcome, Tony. Good evening, Tony.
Hi, good evening, good morning, everyone. How are you? Lovely to be here. Thank you very much for the opportunity. So I'm Tony Catan, General Manager of Mito Foundation in Australia. And in 2023, there were quite a few key milestones, and it's lovely to have an opportunity to talk to you about those today. So the milestones really for us as an organisation, but in particular for the Australian Mito community. So our major fundraising channel, the Bloody Long Walk, is an event series of 11 events, raised $3.2 million in 2023, despite a context of quite significant economic challenges. So for us, we were pretty pleased that it held steady and as I said, a key revenue stream for the organisation. Throughout the year, we continued our focus on developing education for health professionals, particularly general practitioners, highlighting the care standards that were published in 2022. And in addition to our regular series of community events, we held our second two-day National Mito Community Summit in Sydney, and this event aimed to connect community members to each other, to knowledge from experts, and to opportunities to contribute their expertise to the work that we do. Following the legalisation of mitochondrial donation in Australia, the Australian government awarded $15 million to commence the Mito Hope clinical trial. The project's still in its early stages, but is progressing well, and we are working very closely with the project team. And our advocacy efforts also saw government funding secured for genomic testing for Mito, which became available in November last year. This paves the way to significantly increase the rates of diagnosis in Australia. In 2023, Mito Foundation awarded its 100th research grant with a total of over $800 million invested since research was the grant funding mechanism started in 2009. We also took the opportunity to evaluate the impact of that investment, and we've completed a horizon scan on research and therapeutics coming in the pipeline to help identify opportunities for future engagement and research. What was interesting in particular about the impact analysis was that, amongst other things, it showed that we had instances where funding led to significant government or even international funding in addition to what we had funded. One example showed an 11.4 multiplier for every dollar invested. Next slide, please. Coming up in 2024, we've got big plans. We turn 15, which is always nice to take an opportunity to reflect and celebrate, but there's still plenty to do. We'll continue to optimize the Bloody Long Walk event series as a key fundraising channel, and we'll soon be launching targeted research calls seeking to fund research that focuses on improving health services and health outcomes, and provides opportunities for Māori community members to engage in research. Our Māori Stories project is a qualitative research project that will inform our advocacy efforts and the development of future services. And as the mitochondrial donation clinical trial continues, Mito Foundation will facilitate community engagement in the project and provide support to community members who become involved throughout the clinical trial. We will remeasure the impact of our work and impact on the community, gathering information about their needs through another Mito community survey. And we'll expand our health professional education focus to include allied health professionals, supporting Mito community members to build healthcare teams with professionals who understand Mito. We look forward to continuing to collaborate across Australia and globally. In November 2024, the 8th Biennial Aussie MIT Conference will bring together clinicians, researchers, and community members from across the globe, and we hope to see some of you there. We also look forward to continuing our many other collaborations across the mitochondrial disease space, including ones like today. Next slide, please. So very happy 2024 to everybody. This is a festive photo of some of our team taken before our summer shutdown. Not everyone, we've got about 20 all up, and some of you may know Sean, who's on the top right there, who's currently still enjoying some summer leave. And next slide, if you would like to get any more information about anything that we do or have any questions, please feel free to visit our website or reach out to either Sean or I. Thank you very much.
Thank you so much, Tony. We appreciate you being with us, and appreciate you coming in at a weird hour for you because you are so far ahead of us. Thank you so much. We appreciate
it. Saturday morning.
Oh, goodness. Thank you, Tony. Okay, and our final speaker for today's presentation, we have Dr. Richard Bowles with mitochondrial and molecular medicine and neuro needs. Welcome, Dr. Bowles.
Hello. I am having a little bit of difficulty starting the, okay.
There you go.
Is the video on right now?
Yeah, we can see you.
Okay. All right, great. As people that know me, well, by the way, this is Lake Louise in Canada behind me. People that know me will know that I do see patients with primary mitochondrial disorders that have a mutation which causes mitochondrial disease. But my main thing that I do is that I look at people that have mitochondrial dysfunction as part of common disorders, such as cyclic vomiting, autism, ADHD, chronic fatigue syndrome, migraine, depression, anxiety, irritable bowel, et cetera, And I started off looking at the entire mitochondrial DNA sequence to find out which sequences were likely predisposing towards mitochondrial dysfunction and common disorders. And now that we have whole genome sequencing, I use the whole genome sequence. I usually use Variantix, which is a company in the Boston area, to sequence the whole DNA, often in both parents as well, to find new mutations that can contribute to disease. In particular, I've been busy in 3 different diseases in the last year. We'll have a paper in cyclic vomiting syndrome showing that there are around 20 or so genes that contribute to cyclic vomiting. That's episodes of nausea and vomiting separated by having at least less nausea and usually no vomiting. It's a horrible condition. Many of those genes are mitochondrial genes, and many of them are cation channels. That's channels that move salts, positively charged salts across the membrane by having leaks and cation channels. The cations get into the cell. They cause the cell to be hyperactive. It needs more energy if it's hyperactive, and it needs a lot of energy, ATP, to pump all of that ion, whether it's calcium, potassium, or sodium, back out of the cell. So you get a mitochondrial dysfunction, not because you don't make enough energy, but because you use it up too quickly. So I find that energy metabolism is big in cyclic vomiting syndrome, and I have a published paper from in May. The second published paper going over case reports is actually submitted for publication and is in the pipeline. I have a paper in autism showing that de novo mutations in autism, meaning mutations that are not present in either parent, can be found in about half the patients with autism. And there's a preprint that you can get from preprints.org on that. It is in the, actually, it's almost accepted for publication. There were minor revisions that are needed, and it should be in publication pretty soon. The DNA changes were found related to autism in 2/3 of the cases that I was able to make a diagnosis, and about 80% had changes related to autism. 2/3 of the cases, there were treatment recommendations based upon the DNA findings alone, not based upon anything else. That fits into there were 7 major pathways that the genes were involved with. One of them was mitochondrial, and one of them was cation channels, again, which cause mitochondrial problems. There's other pathways as well, such as neurotransmitters and inflammation and amino acids, all of which are treatable as well. So it's not just mitochondrial dysfunction and autism as other pathways, but mitochondrial dysfunction is a big part of it. Right now, I have another study that I'm working with Dr. Richard Fry to look at 100 of his patients and pretty much do the same thing. I'm publishing 50 of my own, and we're going to do 100 of his. So far, the data is more than half the data has been looked at, and the results so far look pretty much exactly the same. But still, more work needs to be done on that. I'm also working on chronic fatigue syndrome, which is a big, horrible thing. That's all diseases has fatigue, but in chronic fatigue syndrome, you feel really bad the next day, malaise. If you overdo it, you feel horrible the next day. That's really the hallmark of that. As many as 3% in one study from the CDC of people have it. Very few people are diagnosed. Probably 1% of the population has it. It overlaps with long COVID in ways that are not really that understood. I'm going through the DNA sequences of 50 people with chronic fatigue syndrome. On the NeuroNeeds website, you can see that there is some analysis of the first 18 patients, and channelopathies, particularly cation channels, same ones that cause cyclic vomiting syndrome, are common, and mitochondrial genes are common as well. Like that was pretty much understood. The other part is I work with NeuroNeeds. I'm a part owner of NeuroNeeds. I'm the scientific and medical officer, and we make products that help with mitochondrial dysfunction, as well as for inflammation, amino acids, and neurotransmission, the major pathways that I see that are involved in common diseases that have mitochondrial involvement. And we have a powder called Spectrum Needs. I'd like to share the screen for a moment. Can I do that?
Yes, Dr. Bowles, you can share your screen.
Okay. Okay. This is a powder form, Spectrum Needs. It has 33 active ingredients. It has 2 flavors, lemon and berry. This is for kids mostly, but some adults like to take powders. This is almost exactly the same thing Energy Needs that comes in a powder form in capsules. This is basically a month's supply for a kid, a month's supply for an adult, but it's based on weight. And this has, in addition to having a very strong mitochondrial cocktail, it also addresses other pathways such as inflammation, immune system, amino acids, neurotransmission, neurotransmitters. And then we have most of you know about coenzyme Q10 as being very important. And ubiquinol is a very bioavailable form. This is a particularly highly bioavailable. It comes from Konica. It's the most highly bioavailable form of CoQ. We also sell this. Most CoQ that's you get over the counter in drugstores. The blood levels do not go up in my patients. And this one, the blood levels go up really nicely. And then I also want to mention the omega-3s. Almost none of us, unless we eat a lot of shellfish and fish, we don't get enough omega-3s. Caveman diet got a lot of it. Most of you are probably removing the lichens and the moss and other things like that and the fungi from your food source. That's where it comes from in a caveman diet, or it comes from the ocean. Omega-3s is really important for health in general. It's important for the mitochondria. It's important for inflammation. But fish oil doesn't go directly to the brain. It has to be converted by the liver. It only converts a little bit. This has a krill oil in it, which goes directly to the brain. High dose fish oil, which is great for heart, skin, nails, hair, and also phosphatidylserine for the brain. And that's it. Thank you very much.
Thank you so much, Dr. Bowles. We really appreciate all of your work, all of your efforts for the community, and it's just lovely to hear about all of the new papers that you have that are coming out, and we really appreciate your research. So thank you so much.
Oh, you're welcome. Whole genome sequencing is really, really great. I love it, and if you haven't had it, think about getting it.
Awesome. Thanks again. So I just wanted to go ahead and take a moment and do a couple more plugins. Earlier today, I talked a little bit about some of our patient support programs, but there are two programs that I didn't mention that I kind of wanted to give its own space to, and that is Wondering Wednesdays, Ask the Genetic Counselor. Devin Schumann is an amazing genetic counselor who comes and we host this once a month, and patients can come and ask questions, and we talk genetics, and she makes genetics really digestible. And it's a great space just to connect around genetics and to ask those burning questions that you're just curious about, or she's really helpful at connecting the dots. The other program that I wanted to mention is that Marcy Young is an amazing Mito champion, and she hosts our podcast series, and she has an amazing way to help people tell their stories. And this is both for clinicians and for patients and their families. And so we love Marcy very, very much. And I just want to encourage you that if you're interested in sharing your story about your Mito journey, or if you're a clinician and you have a new publication that you're about to publish, or there's a topic that you just really want to get out into the community, or maybe you'd like to share a little bit about your personal side as to why you do what you do and what makes you tick, we'd love to hear from you. So please feel free to contact us. You can contact Marcy at mitoaction.org. You can also contact me at sharry, HARRY, at mitoaction.org. So thank you so much for both Marcy and Devin and all you do.
Thank you so much, Stephanie, for that update. Okay, guys, we are at the end. We made it through. Thank you to all of our guest speakers, and a heartfelt gratitude to each of you for being a part of this momentous gathering as we stride boldly into a new year, teeming with fresh opportunities, triumphant moments, and unparalleled accomplishments to revel in. Today, we've witnessed the unwavering commitment of countless individuals dedicated to our Mito community, and we hope that each of you know how much you mean to each of us. I often emphasize to our families a simple truth. 24 hours a day, 365 days a year, a beacon of hope illuminates a laboratory somewhere in the world where relentless efforts are being made to discover treatments and ultimately a cure. With resolute determination, we will forge ahead, supporting one another every step of the way. To every family member, patient, caregiver, we want you to know that you are not alone. Here's to the boundless potential of 2024 and the myriad achievements that await us. May you have an extraordinary year, an inspiring weekend, and we eagerly anticipate staying closely connected with each and every one of you throughout 2024. Thank you so much for joining us, and we look forward to talking with you soon. Take care, everyone.